My name is Hatem Wasanwala, and welcome to my presentation on HIV/AIDS in the USA, France, and Eswatini. So, what is HIV and AIDS? HIV is a virus that attacks the body's immune system by interfering with the body's ability to fight infection and disease by destroying T cells. It's spread through sexual contact, contact with infected blood, or through childbirth. AIDS is the late stage of HIV infection where the immune system is seriously damaged by the virus. There's no cure to HIV/AIDS yet, but medicine can be prescribed to control HIV and prevent it from reaching the late stage of AIDS. Now I will briefly go over the healthcare system in the three countries we are exploring. In America, we have aspects of the Beveridge Bismarck National Health Insurance and out-of-pocket models. We offer private and public insurance, and our healthcare system is unfair and expensive. We spend 18.3% of our GDP on healthcare, $12,914 per capita, and $1,315 average out-of-pocket expenditure per capita. We spend the most but have the worst healthcare outcomes compared to other OECD countries. And on the right, we can see a map that shows HIV prevalence by county. Next, let's look at France. France uses a statutory health insurance system run by the government and has mandatory enrollment. They offer private health insurance called the voluntary health insurance. This is mainly for copays, dental, and vision. Their leftover healthcare costs are paid out of pocket. They spend 11.5% of their GDP on healthcare, $4,491 per capita, $416 out of pocket expenditure per capita. It does not always provide prevention first and creates a system of higher taxation. Eswatini. The government fails to adequately fund the public health sector. Their primary care is relatively free but poor in quality. Most people need to pay out of pocket despite government subsidized healthcare services. They have an informal health sector made up of private and traditional medicine practitioners. They spend 17.95% of their GDP on healthcare, $3,978 per capita expenditure, 9.9% out of pocket expenditure, and health management systems there are centralized and understaffed. We can see a map of how high their prevalence is, and it's pretty uniform. So, what are the outcomes of HIV in America, France, and Eswatini? In 2019, there was an estimated 34,800 new cases of HIV and 1.2 million people living with HIV in America. In France, there was an estimated 5,093 new cases and 156,000 people living with HIV. Eswatini has the highest prevalence of HIV among adults aged 15 through 49 in the world, with about 200,000 people living with HIV. The adult prevalence in America is 0.36%, in France 0.3%, and in Eswatini 27.9%. HIV/AIDS disproportionately affects homosexual men in France and America, and disproportionately affects women and children in Eswatini. How does healthcare coverage affect HIV/AIDS? Of the three countries, France is the only one that offers universal healthcare coverage and has the lowest prevalence of HIV/AIDS. Eswatini's lack of an adequate healthcare system is a leading factor in the extremely high prevalence. And the United States does not offer healthcare to all citizens, which has led to a large portion of undiagnosed individuals compared to France, and has led to only 66% of HIV infected people receiving care. This disproportionately affects the southern states. Efforts to increase healthcare coverage in Eswatini has shown to be effective in lowering infection rates. Next, let's look at how culture affects HIV/AIDS. There's a stigma around HIV and it's a significant reason for the continuation of the epidemic. Eswatini, France, and America all perpetuate these stigmas, and it leads to less people getting treatment and diagnostic tests. France has passed a law to prohibit discrimination against health status to try and address this issue. Homophobia, racism, and other types of discrimination play a role in perpetuating these stigmas and leads to a disproportionate prevalence of HIV among homosexual men in America. Low condom use and low educational standards for women are both cultural factors that impact the prevalence of HIV in Eswatini, especially amongst women. Lastly, let's look at the legislation and programs these countries have implemented to attack this epidemic. The United States has enacted an HIV program that increased federal funding to combat the disease. They have indirectly provided more access to treatment and prevention through the expansion of Medicaid through the Affordable Care Act. The American and French governments have both increased funding for HIV/AIDS research. France finances Global Fund to fight AIDS and has spent $2 billion on funding towards HIV/AIDS and various other programs. Eswatini has created programs and are funded internationally to reduce new infections and increase the scale of treatment. They have been able to decrease incidence by 44% through these programs. Eswatini has utilized community support and created cargo centers to treat infections. Thank you all for listening.